Hello and welcome. We are happy to be a part of your team of healthcare providers. Arizona Kidney Disease and Hypertension Center is the largest nephrologist-owned practice in the nation. We have been helping patients like you since the 1970s, and we are working daily to set the standards of excellence in medical care for patients with hypertension and kidney disease. You have probably been referred to a kidney specialist because your blood work has identified you as having a kidney-related issue that requires specialized analysis and possible treatment. Your kidney specialist here will be working hard to identify the issue and determine prevention and treatment options that best suit you, the patient.
What is a nephrologist?
A nephrologist is a medical doctor dedicated to the treatment of patients with kidney disease. Many nephrologists also specialize in hypertension because of the relationship between the kidney and hypertension.
Why have I been referred to a nephrologist?
You have likely been referred because of abnormalities in labs, including blood or urine, or imaging, including plain films, CT scans, or MRIs. These have identified you as having kidney problems. Other potential reasons are that you may have new onset or difficult to control blood pressure, or you have abnormalities in electrolytes or difficult to control swelling.
What do the kidneys do?
The body is constantly maintaining itself and removing waste products as a part of daily housekeeping due to foods and fluids we consume. The primary function of your kidneys are to help filter your blood to remove waste and water. Certain elements must be retained and not lost, so the kidneys help to balance these elements like protein and electrolytes as well. Additionally, the kidneys help to balance calcium and phosphorus to maintain healthy bones, to produce a hormone to help the bone marrow make red blood cells, and to maintain a normal blood pH so all your chemical reactions in your bodies occur efficiently. Finally, the kidney, along with other glands and organ systems, help to maintain healthy blood pressure.
How do I know if I have kidney disease?
Routine lab work or urine tests can identify patients with kidney disease. There are many causes of kidney disease. More commonly, patients with diabetes, high blood pressure or hypertension, kidney stones, kidney trauma or obstruction, recurrent kidney infections, lupus or other autoimmune disease, HIV, chronic non-steroidal usage, or a family history of kidney disease are at increased risk for kidney problems. Lab work can identify high levels of certain markers in the blood that indicate the blood is not being filtered appropriately. One of these markers is called creatinine. Creatinine is something your body makes naturally. If you're a man or a large muscular person or of African American descent, the level may be slightly higher. Normal levels are usually less than 1. Taking into consideration your age, race, gender, and creatinine level, an estimation of your kidney function can be calculated. Calculators are available to help you calculate your estimated function or glomerular filtration rate. Based on your estimated GFR, your level of kidney function can be staged.
What stage kidney disease am I?
Stage 1 represents normal function with abnormalities like protein found in the urine or abnormal imaging. Stage 2 represents declined function to 60 to 90% function. Stage 3 represents 30 to 60% function. Stage 4 represents 15 to 30% function. And Stage 5 represents 15% or less function. Patients with Stage 3 tend to begin to have associated abnormalities. Patients with Stage 5 tend to feel badly and may need renal replacement therapies like transplant or some form of kidney replacement.
What symptoms will I have?
Depending on your stage chronic kidney disease and what other factors are present, you may feel nothing, or you may feel tired, short of breath, itchy, have poor sleep, poor appetite, develop nausea and vomiting, and weight loss. Some patients with significant disorders in calcium and phosphorus will have bone pain. Some patients with very high potassium will have significant muscle weakness or even chest pain and arrhythmias. In general, the worse the kidney function or the higher the stage, the more symptoms you may have.
I don't feel badly or have any pain, and I make plenty of urine. Could I still have kidney problems?
Kidney disease and the complications associated with abnormal kidney function can be silent, and you may not have symptoms. Routine lab work can help to identify the early stages of kidney disease, where we can intervene. before you progress to more advanced stages where symptoms are present.
What is acute renal failure?
Acute renal failure represents an acute decline in kidney function. Most causes are reversible over time. Changes in medication and frequent monitoring is necessary in addition to imaging and possibly a kidney biopsy to help determine the cause and best treatment plan.
How does high blood pressure affect kidney function?
The kidney is a filter. Blood enters the kidney and divides into smaller blood vessels. Very small blood vessels eventually make up individual filters. There are 1 million total. Over time, high blood pressure translates across these small blood vessels and damages the filter, leading to decreased function due to loss of filters.
How does diabetes affect kidney function?
Diabetes affects the ability of your body to control blood sugar levels. Sustained high blood sugars will over time damage blood vessels. The kidneys act as a filter for blood. Small blood vessels comprise individual filters. Damage to these blood vessels leads to loss of filters and decreased kidney function.
What are my options if my kidneys fail?
If your kidneys fail below 10 to 15% and you're having symptoms, we have wonderful options to help you maintain your health. These options maintain significant quality of life. For those that are healthy enough to undergo transplantation, kidney transplantation represents the best option. Two other options are peritoneal dialysis and hemodialysis. Hemodialysis works directly to clean your blood, whereas peritoneal dialysis uses the inner membrane that lines your inner organs to help clean your blood. Each modality needs an access to access your blood and body. Peritoneal dialysis is done at home and several times a day, and hemodialysis can be done at home or in centers 3 to 4 times a week for 3 to 4 hours at a time. There's also an option to do nocturnal hemodialysis, or basically nighttime hemodialysis while you sleep. Attend the informational session on treatment options and discuss with your nephrologist your best option. Plan ahead appropriately for your modality to prevent complications.
What is an access?
If your kidney function declines significantly and you're close to requiring some form of renal replacement therapy to help maintain your health and replace your kidney function, then your nephrologist will refer you to treatment option sessions to go over all your options. If you're waiting for a kidney transplant or are not a candidate for transplant, there are 2 forms of dialysis that you can benefit from. Each form requires an access to access your blood and your body to clean your blood. Peritoneal dialysis requires a peritoneal catheter to be placed in your abdominal cavity. This catheter can take 1 to 4 weeks to heal so that no leakage occurs once fluid is instilled. Several forms of access exist for hemodialysis, including arteriovenous fistulas, arteriovenous grafts, and catheters to remove the blood from your body, present it to the dialysis machine, have it filtered and processed, and then returned to you. Arteriovenous fistulas and grafts require minor surgeries to create in your arm or thigh. Arteriovenous fistulas are the preferred access and have the least infection risk, but take time to properly mature. Timely preparation is essential for your success. Discuss with your nephrologist the best access for you and begin the necessary preparations as directed to ensure your success.
How does the doctor know I need dialysis or a transplant workup?
Frequent monitoring of your blood work and urine can detect worsening kidney function. Once kidney function declines below 20%, you may be referred for transplant workup if you are otherwise healthy. If you develop severe symptoms related to toxin buildup due to poor kidney function, electrolyte abnormalities like high potassium unamenable to medications, or decreased urine production and fluid overload, you may need to start dialysis. Proper preparation with timely access creation for dialysis is important to prevent complications including infection.
What can I do to prevent my kidneys from getting worse?
It is important to identify the cause of kidney disease and control any contributing factors including diabetes, high blood pressure, high cholesterol, protein excretion in the urine, autoimmune diseases such as lupus or HIV, and to relieve obstructions from stones, prostate, or bladder disorders. Avoid nonsteroidal anti-inflammatories like Motrin, Advil, Aleve, or Celebrex. Avoid or limit iodine contrast exposure. Meet with a nutritionist to help plan an appropriate diet that may limit fluids, potassium, phosphorus, protein, or salt intake. Exercise and maintain a normal weight. Stop smoking. Follow up regularly and obtain the routine lab test that is ordered. Discuss with your nephrologist any new medications. Ask questions and know your stage chronic kidney disease.
We hope this video has helped remove some of the mysteries of what your kidneys do. A word to the wise: follow as scheduled with your primary care doctor, nephrologist, and other specialists. Routine lab work will likely be necessary before each visit with us. We will carefully explain any special test or X-ray imaging we request of you. We will be monitoring your lab work routinely for any indication that you may need tests or new treatments. We encourage you to meet with our registered dietitian to answer questions about your diet in relation to your kidneys. Together, you, your primary care, and your subspecialist, including nephrologist, can ensure your success. Thank you for taking the time to help us care for you.